So I saw something, ne? I saw that people are selective when they talk about this book. They only take an abstract that suits their narrative. With whatever the Constitution is saying, and in relation with the video of the MEC of Health in Limpopo, firstly, the MEC did not deny anyone. No one was denied healthcare. Everything was processed. But now the problem is the payment. So let's not beat around the bush, chase what, and do everything. Now, let's go dig deep on this constitution and also go check something that was prepared by genderjustice.org. It speculates and shows out how the healthcare system works. Sharp. Let's come back and do a notable mention of the keywords that are mentioned here, which is healthcare services, emergency medical treatment, primary healthcare, and so forth. Sharp. This is what was compiled by genderjustice.org. They're explaining the healthcare system in South Africa. You have clinics that treat common health needs, known as primary healthcare. And there are different types of clinics, such as mobile and satellite clinics. Clinics refer patients to hospital if needed. Then you have community health centers that are larger clinics, and they usually have a doctor as well as nurses. Community healthcare centers refer some patients to the hospital if needed. Then you have hospitals are for surgery, emergency treatment, and serious illnesses that cannot be treated at the clinic unless it's an emergency. A patient can only access hospital if they are referred. You understand? Thank you. So meaning that lady on that video maybe went to the clinic, to the community center, to the hospital or whatever, but she was assisted. So let's get that one out of the way. The payment issue, then they will sort that out. And then they touch based on the laws that are contributing in this whole matter. And apparently this was compiled by the Johannesburg Migrant Health Forum. Okay, let's just go. It touches based on what we talked about on the Constitution on the previous page and what we talked about up on the National Health Act on the previous page. Now we're going to focus on the Refugees Act, the Department of Health Circular, and the Immigrant Act. The refugees in South Africa have the same right to access healthcare as South African citizens. As set out in the Constitution, the right is also considered to include asylum seekers. That was done, Mos. That person was taken care of. But the issue is the payment. Then, Department of Health Circular. The circular confirmed that the refugees with or without permits can access the same basic health care as South African citizens, including treatment for HIV. Okay. Then the Immigrant Act. The laws above are clear on refugees and migrants' rights to access. The Immigration Act is different. It states that staff at clinics and also must find out the legal status of the patients before providing care. Neville, did you hear that now? So now what happens if you are not illegal? Then must take all the laws in place. Sharp.